Hi, I'm Adhiti. I live in Ellington, Connecticut, and today I want to talk about a very important clinical trial study that Duke's pediatric trials that were conducted on the medication oxycodone. The study was titled The Pharmacokinetics of Oxycodone in Breastfeeding Mothers and in Breastfed Infants. Did you know that oxycodone, a pain-relieving medication often prescribed to mothers during their pregnancy, can actually pass on to breast milk? Well, it can, and researchers and clinical trial investigators knew that a certain amount passed, but they didn't know how much until the study was conducted. And this information is vital because families and healthcare providers need to know how to make safer decisions about medications and also on breastfeeding babies. What researchers found is that any amount less than 60 milligrams a day is unlikely to cause significant exposure in breastfed infants. The study also found that the amount of oxycodone in the infant's blood was very low to undetectable, and no harmful effects were found with the medication in this study. Thanks to this study, the new oxycodone label now includes clear information about how the medication is processed in breastfeeding moms and their babies, and helps healthcare providers figure out what they should be dosing after birth. This was an important finding because these results were submitted to the United States Food and Drug Administration, or the FDA, to update the official oxycodone label. And this label is what healthcare providers use in order to ensure that they're prescribing medication safely. Pediatric research matters to me as someone that's very interested in pediatrics because children deserve to get medications prescribed based on real evidence and not just assumptions. And children process medications very differently than the adult body, so it's very important that different age groups are studied from babies all the way to kids that are 17, 18 years old in order to ensure that the dosing recommendations that they are receiving actually work for their body and are as effective as possible. Studies like this help families make more informed decisions about one of the most vulnerable moments in early life. And research like this contributes to more effective practices for improving child health, which is very important to me as this is something that I would like to continue contributing to and researching in the future. Thank you so much for listening, and thank you to the Pediatric Trials Network for making research like this accessible for youth that are interested in pediatrics.